Okay, application we're going to do today is for anterior lateral ankle pain, so front and side, so that's the anterior lateral, and oftentimes patients will complain of pain right in this area, and this is the area of the anterior talofibular ligament. Also, the most common ligament being torn when we do an inversion sprain, and pain will occur in this position. Now, what we want to do is we want to have our patient pull the foot up and hold it in this position so we can shorten the tissue over the ATFL in this area. So, patient is pre-positioned. We actually don't have any tension on this tissue. Little tension right here, but no tension over this specific spot that we want to change with taping. So the first thing that we're going to do is I'm going to take our strip to our 2-inch anchor, and I'm going to put it around here. I'm going to start behind the medial malleolus. Okay, there's my anchor. Okay, and then I'm going to paper off tension, pull this around the foot, 10% tension, go right over that portion of the ATFL, the anterior lateral ankle. Again, 10% tension on the tape, 0 tension on the ends. There's step number 1. Step number 2 is, again, we tear. Okay, and now we're going to go in front of the medial malleolus. Paper off tension as we pull around. You'll notice that it creates a slight X under the foot. So we go around, and now we're going to go to the back side of the ankle. Again, 10% tension, the back side of the ankle, just like so. Again, no tension on the ends. All right, scoot down for me a little bit, please. Okay. Now, this last piece, we're actually going to tear both ends. So 2 inches on one end, 2 inches on the other. Remove the center piece. When we're placing this, we'll place with it being slightly offset, so approximately 10 to 15% tension, slightly offset. So the longer piece is on the outside, the shorter portion is on the inside. Come in, set this down. We have these pieces on the ends still in place. Okay, and then I'm going to take my ends off. No tension on the ends whatsoever. The purpose of this last piece is to help support the ankle into this outside position as it wants to go, and help to reduce, much like these two other pieces, helping to prevent a reoccurrence of a lateral ankle sprain. Again, 10% tension on all of these, 0% tension on the end. Pre-positioning on this is critical, staying in neutral to reduce tension over the ATFL.